The 35-year-old accused of operating a makeshift medical cosmetic center out of her Oakland Park home.
She reached out to me through social media and told me that she would give me a really good price.
The ordeal that left her sick and scarred.
Did she put this under the guise that she was a licensed, active medical provider?
What if the cosmetic treatment you booked landed you in the hospital for 3 months? Today, I sit down again with Bea Amma, a survivor of illegal cosmetic injections that left her fighting a flesh-eating skin disease for the past 5 years. We're breaking down a case in Florida where a woman was recently arrested for running a cosmetic clinic out of her home. The victim thought she was getting hyaluronic acid. When doctors examined her, they found something much, much worse. Get an update on Bea's recovery and learn why these illegal clinics keep getting away with it. And I'll share with you what I've created to help you identify the safe med spas from the dangerous ones. And as always, please subscribe to stay informed in the ever-evolving world of medical aesthetics. Bea, thanks so much for joining me today. I really appreciate it.
Absolutely. Thank you so much for having me. And I mean, it shouldn't take 5 years for us to see one of these illegal practitioners get arrested, or if that's what you want to call it. But, I am really excited to talk about this case because hopefully, all states start taking it a little bit more seriously.
Yeah, well, actually, there have been a number of arrests in about illegal activity in the med spa space. But this one, when I saw this reel, I thought, wow, this is so similar. So let me go to that case and I will read a little bit of information about what happened. So the person who was arrested, this was in Oakland Park, Florida, and it was in mid-December 2025, so it was a couple months ago now. This woman's name was Megan Whitcomb, and she was accused of running an illegal cosmetic clinic from her home. She was giving various cosmetic injections, including Botox and what she called Botox, filler, and other injectables. And in this case, the victim came forward and reported that she had been 3 times to this woman's house. She had gotten what she thought was Botox, filler, and buttock injections. All 3 times, they were extremely painful, eventually requiring hospitalization. She complained of bruising, swelling, redness, pus, and unhealing wounds. Does it sound familiar? And she thought that Megan was licensed. And one time she was given a pill that made her throw up. And she says she was given twice something that she thought was called rock crystal, which as a physician, I can tell you I'm not really sure what that's supposed to mean. That the procedure lasted 12 hours. And she thought she was getting hyaluronic acid, but when they looked at what was actually in her, tap water and baby oil and some other things, she said, I'm not sure what those other things were.
Mind-blowing. I mean, tap water just makes me think mycobacteria, how did she get out of this so lucky is the first thing that I'm thinking.
So for you were in the hospital for over 3 months, right?
I was in the hospital for 3 months, and then I was on IV antibiotics for 8 hours a day for the first year, and then in total 3 years, and then 6 hours a day.
I mean, it's mind blowing how much medicine that is. I mean, that's crazy. It sounds like this woman, this victim, although I will say in the video, they show the suspect, a woman accused, Megan Whitcomb, they show her walking out of her bail hearing where they posted bail. And she says there was no victim in this video.
Yeah.
But so she reports that it took months to recover. And for you, it took a good 4 or 5 years.
Yeah, 4 or 5 years now.
Yeah. Do you still have scarring and stuff?
Yeah, the scarring is overwhelming. I mean, it's just always going to be there and affect me. I think just because there's hundreds of scars for me, and mycobacterium is just extremely tricky. And so anyone who gets out of a situation like that without a flesh-eating skin disease is really lucky. Other infections can be a lot easier to fight. And I'm not sure if she had just the redness, or I don't really know what her illness was. They didn't really specify where I was reading about it, but
it didn't specify what she actually So it didn't say whether she had an infection or not, although very
Yeah.
highly likely she had an infection. And it didn't say if there was any other, consequence other than scarring and slow healing. The big difference is that when she came forward, the police and the Department of Health did an undercover sting operation, and they made an appointment with Whitcomb. Weirdly, the appointment, she quoted them $24 for 24 units of Botox, which is $1 a unit.
Or a unit is just nuts.
That's impossible. So just for everyone at home, like it costs, if you just buy it from Allergan, it costs about $8 a unit just to buy it. And then, of course, you need supplies and overhead and insurance, all that. So there's no way anything that cheap would be actual Botox. Interestingly, they did say that when they arrested her, she had an expired bottle of Xeomin that she had brought out. So Xeomin is another actual neurotoxin. It's made by a different company besides Allergan. So it's like Botox. It's a little bit different from Botox. I don't personally like that one because it tends to not last very long. But, some people argue with that. Some people like it. But either way, I'm not sure so you couldn't get actual Xeomin for that price either. So I don't know I don't know how she would have obtained that or if it was real Xeomin. It could have been fake. I don't know. They didn't say it was fake. They said it was expired in the news report. They said it was.
But they really have no way of knowing if it's a counterfeit product. Even now that like detectives and stuff have a really hard time telling apart, there's a big issue with counterfeit Botox and it's like all labeled exactly the same and everything. And so even if it says it's expired, it could have also been easily ordered from China or something. Not to speculate, but it is.
Right. It's impossible. It's really impossible to know how she could have gotten either real or, fake Xeomin you can get off the internet. And actually real Xeomin, there are sites where you can buy it illegally as a non-physician, but you can't be a layperson and prescribe a medication like that. You can't even be a nurse. Nurses can't prescribe Botox or Xeomin. You actually have to be someone who can prescribe medicines. And so anyway, so they took pictures of a bunch of syringes that weirdly, so they call them in the news report, they call them needles, but actually they took pictures of what are syringes, right? And they all look piled up. They're not sterile. They're piled up with various amounts of various fluids in them. So when I see that, I go, ooh, oh my God, none of that's sterile. I wouldn't want to come anywhere near that because what I think a lot of people don't understand is like, if something's going inside of you, it has to be sterile. You can't have tap water or other things that are off your kitchen counter and put inside of you. Okay. That could kill you. And it's weird that people don't seem to understand that.
I think people just don't understand the power of bacteria. Even whenever I was younger, I had no idea that flesh-eating bacteria was even a thing. Like, I just don't think that there's much awareness on, again, like what kind of bacterias are out there. And I think people maybe also take antibiotics for granted and everyone thinks that it's going to be a quick fix if you do get an infection of some sort. And it's not always a quick fix. Sometimes it takes years. I know tons of people who have had other bacterias that are less aggressive as Mycobacterium, and they've even had to be on antibiotics for years.
Yes. It's very hard because when you prescribe antibiotics, you have to explain to someone, okay, we need to treat the infection until every single bacterium is dead and they can't regrow. So if you have to take the whole prescription. And if there's any sign of infection by the end of it, you have to keep going to make sure you get them all. If you kill off, 95% of all the bacteria, but there's just a few left and you stop, they'll just regrow. So it can be very difficult to get rid of an infection. And that's if the bacteria is sensitive to that antibiotic. If this bacteria scoffs at the antibiotic and says, I'm totally not going to get killed by that. Well, that's a joke. Which is Mycobacterium's like that. So Mycobacterium is very, very resistant. It's very hard to find an antibiotic that's going to actually kill it. It's very hardy. It hangs out and it hides, festering for a long time. And that's that's why I think at some point when we were talking before, you were saying that you had a surgeon who wanted to actually cut out a few areas that there was still infection that was walled off that they couldn't get rid of with antibiotics, right?
Yeah, I went through all those surgeries.
I think it's really great that this woman got justice. I do hope something happens to this perpetrator. I mean, she obviously hasn't, I don't think she's to trial yet. I did try to find an update if anything's happened. I know she got out on bail, but I really don't think that the trial has happened yet. So we don't know what's going to happen to her.
The $5,500 bail is still like a little shocking to me. You could have killed somebody and your bail is only $5,000 because you didn't, like just because of luck and circumstance. But the intent there is complete negligence. You know that you are practicing medicine without any credentials whatsoever. You know that you're not putting in the actual product into these people. You're false advertising. Like, I don't really know what these perpetrators think is going to happen when they're in these situations too, or even doctors and you know, a lot of, or sorry, not doctors, but like the cosmetic surgeons is more so what I'm referring to, who know that they're doing some questionable things or cutting corners or not sterilizing the cannulas and other surgical materials properly. You know, there's just a lack of like regulation and scrutiny on all those cosmetic doctors as well. And I wonder like what's going through your head, because I do think that there's like some kind of separation where these perpetrators, they don't actually think that they're hurting a person. They're saying things like, this is not a victim. And the same thing was told to me by the people that did it to me too. Like I was not considered a victim in their eyes. They weren't doing anything wrong. They were doing exactly what they said they were.
Right. And that's basically denying that you should have a medical license to practice medicine. But obviously, that's a law for a reason. It's there to protect patients from exactly this kind of thing. I do think that, so $5,500 bond, her lawyer pled for leniency because she's got 2 young children at home.
Yeah.
I don't know if she's a single mom. I don't believe I read that or could see that in any of the reports. But they paid that. I do know part of the arrest report court records showed that she's actually facing eviction in her home because she's behind over $10,000 in her rent in her Oakland Park home. I do hope that this and other arrests are a message to people like that to stop doing what they're doing. I don't think it's going to stop everyone, but I do think that if there are consequences for this kind of illegal practice, that fewer people will just jump into it and do it. There was a recent report that I did a podcast on out of New York that showed that 60% of medical spas that they investigate over 300, 60% of them were operating illegally. And a lot of them are these sort of, you know, some injector comes in and uses one of the rooms in the beauty salon, you know, however often. Or there was another case. So when I was researching the case in Florida, there were 2 other cases in Florida that I found that happened around the same time. One of them was, and I don't really know if you pronounce it, Port St. Lucie.
I remember seeing that one hit the news. I had a bunch of...
It was in July of 25.
Yeah.
A woman named Rosa Mania. She was 50. And she was found to be running an illegal spa in a backyard shed. It was a separate backyard shed. They showed pictures in the news article where it looked like a neat little space with a actual medical spa bed that was there. And she had one machine that looked like some kind of laser or RF device, one machine that might have been sort of a hydrofacial equivalent. It wasn't hydrofacial, but it could have been something like that. That's what it looked like. Kind of hard to tell. She had no license of any kind. And they found, you know, vials and needles and the laser liposuction. And that's one thing that I read. I don't know. I know a lot less about that case, but I do know that this person was actually arrested. And I feel like the fact that there are arrests now is actually a good sign of change anyway, more awareness and, more concern on the part of law enforcement. So it is getting slightly better. But in the time since your procedure happened, the industry's just continued to explode. There are more and more of these illegal practices out there. So just because there's a little bit more attention to it and a little bit more law enforcement, it's still, the problem's actually getting worse.
I agree. I remember seeing that case and seeing the images of what her like little shed med spa looked like. And it did look decently nice inside, and it had a nice bed and everything. Do you know if she is in jail still, or what's the update?
I couldn't find updates on, it's interesting when you look these cases up, it hits the news when it happens. And then the news doesn't do a follow-up. And then, so in order for me to find that information, I really would have to be able to pull the
Records.
the court records and stuff, which is not, I'm a doctor, not a lawyer. So I really try not to offer legal advice off of this podcast, but I do know what it's like to be a doctor. I know what it entails. I mean, to get a medical license and maintain your medical license. I mean, it's not just getting that in the first place, but we have continuing education, we have continuing requirements, and most people have, credentialing they have to go through, and, inspections for various licenses. Even just to get a cosmetology license in just about every state, you not only need to have gone to school and to become an esthetician or a beautician and get your license, but they do inspections and they care about cleanliness and sterility. And Liz, we have a salon license in my med spa because we do facials. And so we have a license for that. And they come and inspect, our facial room to make sure that the garbage cans have lids on them. And, it's very particular, right? But for these people using, doing sort of a backyard makeshift, fake med spa medical practice, there's nobody looking. So until a victim reports this, nothing happens. And the problem is that I was just talking to someone on the phone today who reported her personal experience about getting lip injections. This was 19 years ago, I believe. So a long time ago, back when filler was new. And she didn't know anything, didn't ask enough questions. She was like 19 years old herself. And this random person in her home injected her with like a liquid silicone. And that is permanent, doesn't go away, was disfiguring. She's been dealing with it her whole life, had to have surgery to remove some of it. Really hard to remove liquid silicone because it spreads around and you can't get it all out. But I asked her, I was like, do you want to tell your story publicly or not? And she's like, ooh, let me think about that. Like, she just, even though it was like 19, 20 years ago, and she was a teenager when she made that decision, right? It's still like, it's embarrassing, right? People feel like, oh, it's my fault. I should have asked more questions. And it's like, well, no, it is really hard. I say it in every single podcast, like, ask all the questions. But
it's so silly. It's like, if you were to go to a restaurant and order a cheeseburger, is it your fault if you eat the cheeseburger and you get a rare flesh-eating skin disease from the cheeseburger? And is it your fault for not asking if they were supposed to be selling cheeseburgers? Like, do you ever walk into a restaurant and verify that they have all their credentials and that they're even allowed to be selling food? Nobody does that. This is about the safety for the consumer and us basically being failed on a federal and government level, and just lack of law, lack of legislation, lack of protection. That's the issue. And it sucks because you do carry so much shame as a victim, and you are constantly victim blamed. But then again, we look at the other side of the coin and it's like, well, all of the amazing work that we see, like the gorgeous breast implants and BBLs and lip injections, and just the people who have clearly had cosmetic work that it just looks so good, they're never shamed. They're only complimented because, wow, your results are so impressive. But God forbid you be on, the wrong side of of the coin or just, get some bad results, all of a sudden it's your fault. You did something wrong. And it's like, no, it's never your fault. It is all the fault of the person who is injecting silicone into people and injecting or doing any kind of procedure, knowing that they are cutting corners or just doing something unethical. And it sucks because it does feel like the victims take all the blame.
And it shouldn't be that way. And I do emphasize, ask the questions. If you're a really aware consumer, ask those questions. Who is the medical director, and look up their license? Who is doing this thing to me, and look up their license? And are they legally allowed to do this? And are they using real product? That is, by the way, so since we last talked, I have helped to found a new national organization called the Med Spa Board, and we are actually asking those questions for you. So any med spa that is able to say we are certified by the Med Spa Board, that all of those answers have been already vetted by
Right.
our organization. So we just launched. We've got, I think, 12 med spas that are approved now. We're working on it. But I think that will catch on and people will ask their places to get certified, because there does need to be an easy way to identify the legal places. Okay. There's got to be easy labeling. And we cannot wait for someone to be harmed, scarred, or even killed by one of these places for any enforcement to happen. Like, that is too late, right? So we need an easy way for people. We need more awareness that these things are really important, that the law is really important. It would be great to have a national set of laws. So right now there's different laws in every state.
Yeah.
The Med Spa Board is implementing a single set of requirements across the board. So it doesn't matter what state you're in. Now, the only thing is corporate practice of medicine. So that I don't want to bore people with, but like, in some states, it's illegal to own a medical practice if you're not a doctor, right? In many states, those laws are very, very variable. And so we're not busy trying to enforce CPOM laws, but we do make sure that each spa that we're certified actually is owned legally.
That's awesome. I mean, kudos to you. But also at the same time, like, that should have been in effect, and it should have been put into effect by much larger and more powerful people.
Because who am I really?
And I'm sure it feels like you're fighting upstream, like you're definitely fighting an uphill battle there. And I mean, it's 12 med spas is incredible. You got like more than 12,000 to go.
Well, we are working on it. Well, the thing is that most of those are not legal. So they're not going to get certified, because if New York is any example, then 60% of med spas are illegal. And that's okay, because the 40% who are operating legally, we should all get certified. So of course my place, first place that we did. But yes, I'm very much hoping that people listening to this will actually look into it for the spa that they either own or run or work in, or your favorite spa that you go to that you think is awesome. Just ask them to get certified, right? And that way, if it catches on, I'm working on some other ways to reach a broader audience so that people will have more awareness. I think it takes years really for there to be that kind of awareness. It's kind of like when certified organic came on the scenes years ago. When I was growing up, there wasn't any organic food. You couldn't get an organic tomato, but now you can. It took many years for people to have a label that was recognizable and have that label mean something, so they would know what that meant. Oh, okay, that label means something. Well, I'm kind of hoping that Med Spa Board certified has a meaning that becomes valuable to people. But we're at the beginning stages of that. So we're hoping, I think, but for now, for anybody. So first of all, if it's in someone's home or in their backyard or in a shed, run. Okay. Don't just take that as a red flag. Just run away fast.
That alone should be illegal. Like, it should be immediate jail. Like, if you're not practicing in a legitimate establishment, you should go to jail. That should never be an option. Right. But that's not a thing. And again, also, news coverage, great. We love that we have some arrests going on the news, but again, and sure, it'll cause some fear in the consumer, and maybe it'll cause some fear in the, practitioner side of things. But at the end of the day, if we also see that these practitioners are getting away with doing these kinds of things and they aren't really going to jail or, being charged with felonies, and if they're able to get arrested and still get away with it, then that's going to cause a greater issue, in my opinion.
Yeah. Oh, I mean, agreed. I mean, it is such a bigger problem than most people understand. If it's a $20 billion industry, which is approximate, it's probably bigger by now, and 60% of that is illegal. Well, okay, so that's $12 billion pushing illegal activity. That's a lot of money, and that's a lot of force, and that's a lot of power. And as we know, in this country, when there's a lot of money involved, there's a lot of fighting about it, and there's a lot of, defending your business, even if it's illegal, right?
Yeah.
And so, that's why I've sort of taken to the airways and hope that people are listening. So I would love to hear an update from you, like just let everyone know how you're doing, because you look amazing. So I know that, it's been 5 years since all this happened to you. You're living in Florida now, right? So,
Yeah. Well, I originally moved to Florida because the whole cosmetic surgery issue out here, unfortunately, the doctors in Florida are a little bit more familiar with these flesh-eating skin diseases like mycobacterium. And so in LA, I was starting to kind of become like a forgotten patient because the doctors just didn't know why I wasn't getting better. And then a lot of doctors didn't want to operate on me. So I moved to Florida. I found an infectious disease doctor. But at that point in time, too, we had done everything that we could have done on the infectious disease side of things. I've been on antibiotics for so long that it was reaching a point where it was doing more harm on my body than really good. Mm-hmm. And that's where surgical intervention was necessary. So 2024 to 2025, I was on oral antibiotics still and just doing an extreme approach to removing the bacteria via debridement surgeries. And I ended up getting a tummy tuck last January. Yeah, January 9th of 2025, just because there was the most centralized area of infection, and there were some recurring areas as well that were starting to scare us and just scare me. And so we removed that. We removed a ton on my arms. And then there was obviously the psychological and mental process of having a whole bunch of new scars to deal with on top of my old scars from the flesh-eating skin disease. And so a lot of body image difficulties, if that's what you want to call it. And then last March, I came off of all antibiotics, and I have been off of all antibiotics since last March, which is a major win. So that means 1 full year without being on meds, without having flare-ups, without having surgeries. There have been a few areas that have had small flare-ups, and sometimes stuff will come out of like those areas, unfortunately, but it doesn't scare me because I'm like, okay, well, my body's pushing it out. It's like if it was red, inflamed, hot, and I was having those symptoms from before, then I think I would get a little bit more scared. I just take this as my body doing whatever it needs to do to continue fighting. But I truly don't think that the mycobacterium is going to come back. I do think I'm finally at a point in my life where I can move on from this, actually, thank God. But at the same time, with mycobacterium, you always have to be careful, because if I get a virus or I get sick or my immune system drops down to a level to which it's not able to suppress any residual mycobacterium or mycobacterium spores that are in my body, boom, it can just easily grow right back. And that's something that I consciously have to remember, like, okay, I still really have to take care of my body to make sure that because I think like your full remission for mycobacterium is 7 years without any regrowth, which is just massive.
Wow. Yeah. Almost like cancer. Like it can come back really late.
Yeah. So I need to make it 7 years before I get excited.
Really, and I didn't know that they had a number on that. So, I mean, just for people at home to understand what that means is the kind of bacteria that Bea got is this type that kind of sets up shop and smolders and walls itself off. So it's really hard to get rid of. And so you can have little pockets of it that just hang out. And so if she were to get immunocompromised in some way, then they could grow because her immune system's no longer, holding it at bay. And so they're saying, okay, 7 years, once you're at 7 years, you're pretty sure it's not going to happen, which is a long, long, long time. I'm really glad that the last year's been, essentially problem-free, almost essentially.
Yeah. And I'm thankful that I was able to have those surgeries without getting complications. Looking back, that was extremely high risk. And I understand why so many surgeons didn't want to operate on me. Mm-hmm. And I also realized that I was putting myself in danger just because if something had came back or if I got reinfected through one of those surgeries, that it would have completely changed the trajectory of my healing and essentially started everything all back over again. And so I feel extremely lucky because of that. But also, too, I'm approaching this point in my life where you fought so hard to get rid of a disease and then you have to deal with the physical aftermath of it all afterwards. Mm-hmm. Looking at my body every day, trying to accept these changes, the insecurities that come from being a victim of something like this. And you carry it with you every day. Every time I take my clothes off, I'm just like, oh my God, I can't believe this is my life, And, all the time people are telling me, wow, well, thank God it's not on your face, or thank God as long as you have clothes on, you can't really tell that something happened to you. And it's like, yeah, sure.
That's cold comfort, though. I mean, it's your body.
But there's so many victims that they're having to wear prosthetic noses, or they lost, a side of their face, or they had a stroke on one side of their face because of it, or whatever it may be, or not the vascular occlusion. I mean, the vascular occlusion issue is massive and it's happening to so many people and it's affecting people's face. And it's like, this sucks for me. I can't imagine also being in the shoes of a victim who has to look at their face every single time in the mirror, have conversations with people. We get our first impressions based on someone's face, and the kind of insecurity and pain and hurt and shame that they have to live with being a victim of one of these, fraudulent practitioners. So I feel a lot of compassion and sadness and empathy for other people who are in really similar shoes.
Yeah, absolutely. And if anybody listening to this or watching this on YouTube wants to share their story, but you've been too scared to, or too embarrassed to, or you don't want to reveal your identity, that is fine. But please reach out, because I'm happy to share it for you without revealing identity. Or if you want to come on the podcast and actually talk about it. Not everyone is so brave. So be it. Thank you for being willing to do that. And I am encouraged that there is more law enforcement in this area. So, we can hope that we're going to see some change. I think that there's a movement for political change as well. Definitely, there are several states looking at more regulation of med spas. And I hope that they do the right thing too, because what we saw in Texas last year, after there was that woman who died, who got the IV in this med spa, somebody who was completely unlicensed, right? The thing is, they want to come down hard on the licensed people. And I'm like, can we first eliminate the unlicensed people? I mean, I'm not saying that the licensed people shouldn't be right. We absolutely should, right? And that's what the med spa board is trying to do. But the Texas law didn't actually help with enforcement of making this type of thing, like this Florida lady or the woman who killed Jennifer Cleveland in Texas. It hasn't made it easier to prosecute or discourage or eliminate these illegal places that are actually really, really dangerous. So,
I feel like the law is still having a hard time prosecuting any of these kinds of cases. I mean, I remember I hired a personal assistant when I was completely broke from being in so much medical debt, just to email every single DA and government official possible to get somebody to pick up my case. And nobody would pick up my case just because there's no protocol. What are we going to arrest? What are we technically arresting you for? That's the issue number one. And then there kind of needs to be like a bridge in the gap, because what happened to Jennifer at Cleveland is I think that's the name of the victim, or they're calling it Jennifer's Law in Texas.
Yeah.
But what happened there is happening in a ton of these other med spas, where some doctor will slap their credentials on a med spa and let unlicensed people practice. I think both parties should go to jail. Like, you did that as a licensed professional. You have a duty to keep people safe. And then you think that doing a once every quarter training or pop up into this med spa is enough to make sure that you're not putting people's lives at risk. Like, it's completely negligent.
Yeah.
Everybody should get arrested. Everyone should.
And that is a really big thing that we're working on at the Med Spa board is the medical director has a duty to keep people safe, and it's the medical director's medical practice. That place is their practice. They have to own it, run it, oversee it, make sure it's safe. And to get certified, we're actually interviewing the medical directors and making sure that they're actually doing that. And then they have to sign an attestation saying, yep, I'm really actually doing that. It's my practice.
And how frequent do they actually need to be in their own practice?
As a physician, as a medical director, I'm in my clinic on average at least once or twice a week. But my thing is I'm always responding to clinical questions, concerns. I talk to patients. I still see patients a little bit. I go to all the trainings. I make sure that whenever we have something new or different or anything comes up, we're doing a training on that. Like, I know my people really, really well. I only oversee one spa. So I know, and these people have been working with me for years. And so it's going to be different for every physician, depending on how many people they're managing and how many, patients they're seeing. How often do they need to be there? How confident do they feel that they're all doing a good job? Like, when I have someone new and I'm training them, I spend a ton of time making sure, I haven't had to do this in years, thank goodness, but it takes a ton of time training, checking in with them. They're always working under you until they're doing a little bit on their own, more and more over time. And so that's going to vary. That varies quite a bit, right? And how much time. And also, and so part of that is it is the doctor's practice. So they have to know. And the reason why I don't like these absentee medical directors who are just not there, because they're never there. They don't know about it. They're not overseeing it. They're just not. And I think that's like the dividing line, because if you're really a doctor and you really have a license and you actually care about your medical practice, you will be up all night long if you think it's not safe. You will just not be able to sleep. It's awful, right? And so for these people who so in that case, the Jennifer Cleveland case, that doctor, his name was Michael Gallagher, and he's an anesthesiologist in Texas. He worked over 100 miles away in a hospital. He did not go to that spa. And the woman who owned it and ran it and killed Jennifer Cleveland had no license. Okay. So why he thought that this was okay, it shows absolutely no medical judgment, right? No medical judgment at all. And by the way, he still has his license and he's still practicing anesthesia.
Nothing really happens, I've seen in these cases similar to this one, to the doctor that actually has like the medical license and everything. That is just like mind blowing to me. As a hospital, it's like, if you have the kind of character and the lack of morality to where you can go and do this, you're an anesthesiologist.
Yeah.
Well, I don't know if I want you practicing on people in my hospital. You are a risk for our hospital, the insurance. You're just a flight risk overall. You did something illegal. You should not get to work anymore.
So when that whole case was going on, I felt like, so I don't know about law. I was trying to ask my lawyer friends, like, what is this? Is it negligence? Is it malpractice? Is it manslaughter? What is this? Is it false advertising? Is it, it is so hard to understand, like, what, I think it's probably many different laws, right? I know that practicing medicine without a license is a felony, right? But technically, this woman was in Texas that does allow non-licensed providers to work under a doctor. So it was the doctor's responsibility to make sure this was safe. So was it negligence? Was it, I honestly, I don't know. But as far as I know, nobody was ever prosecuted.
And I fear that that's what's happening in the majority of them.
Oh, absolutely.
Prosecutors just don't know what to do. They don't know what to charge them with.
Yeah.
And it should be manslaughter.
I think, doesn't it make sense, right? They conspired to make money, risking people's lives, and they killed somebody. So to me, I don't know. It seems like, but again, like I don't, it's just so, it's so unbelievable that this is going on so much, because it's not just one thing. It's not just one event. It's
cosmetic surgeons, they get away with killing people all the time doing these BBLs and, these awake surgeries and all of that. That's so popular here in Miami, especially. Like, they get away with it. I literally know someone who was just killed at a really popular surgeon's place because of BBL. And that's like the third person he's killed. And nothing has happened to the guy. Nothing has happened to the guy.
That's interesting. Well, you would think, I don't know anything about that particular.
Fortunately, I can't say anything about it, but like, if you dig deep enough, you will find stuff like this on a multitude of doctors, especially these popular ones.
Well, so just so our audience knows, like, if you do know of some kind of, negligence on the part of a physician, you can report that to the medical board, and they have to investigate that. If you know for sure that a crime's been committed, report it to the Attorney General's office. That's who's in charge of that. And of course, if you know of somebody like who is a nurse or a nurse practitioner, then report that to the nursing board. And again, also estheticians to the cosmetology board. There's all these different boards. But it's interesting because if a board has not licensed you,
then they can't.
They throw their hands up and say, well, we didn't have a license. Can't take it away.
That's what happened in my case too. They were like, well, they're not registered on any one of these, so there's nothing we can do. We can't
take their license away because they never had one. The other thing that happens, and also happened in your case, is because they're not licensed, they don't actually even have any insurance. And so, as a physician, I have to have malpractice insurance. So God forbid something goes wrong, I have malpractice. If you're illegal, you have no malpractice insurance, no liability insurance. So someone, they could sue you, but they're not going to get anything. They could get maybe your home. But usually what happens is that the lawyers won't take the case because there's not enough money in it for them. Yep. The way that there's money in it for them is if the liability insurance has a high limit. So they sue you for $1 million or $5 million because that's the limit of their insurance policy. And so the lawyer might get a payout if they win. Whereas if you're just suing a private citizen, you're going to try to take their home or something. They don't do that. They just usually will just not take the case or tell you, you don't really have much of a case. And
yeah, but even in the case of Megan here in Florida, she has nothing.
She's got nothing. Right. Yeah. So
you can't sue out of thin air. And that's, so many people don't understand. The number one thing that people still to this day comment, like, oh my God, I hope you sued them for everything they had. There was nothing in her name. She knew where to put the assets so that even if I sued her down to a cellular level, there was nothing.
Right. There's nothing to get. Yeah.
There was nothing.
Yeah. Yeah. So anyway, so to wrap up, at least we have a slight change in the industry, a slight change in law enforcement. We're going to keep talking about it. We're going to keep educating people. And I just want to thank you again. It's been such a pleasure catching up with you after all this time.
Anytime. I'm always down to do one of these. So thank you.
If you found this helpful, do me a favor and share it with a friend who's considering any aesthetic treatments. Subscribe so you don't miss the next one. And drop a comment telling me your biggest takeaway. I actually read them all. Let's keep each other safe and elevate the standards in the med spa industry.